Test, test, test.
Masuk sini ke? Ni ke? Tambah. Ke dia mau masuk?
Ini dah ada slide.
Oh, dah ada slide dah. Oh, dia dah share dah. 58 ni. Dah ada.
Tak sampai PTA sikit je. Lepas setengah jam sikit lah. Saya nak tahu nak cakap lama sangat atau dah pendek sangat. Saya nak tahu nak timing. Biasa dia orang ni cakap pukul 8.30, 8.45.
Paling nafas 8.45.
Paling lewat. Itu dengan soal jawab.
Dengan soal jawab.
45 ya. So saya pukul 8.30.
Sekejap sangat. Tadi ada kalau yang biasa paling lambat sampai 9.30 lah kalau ada orang cakap semalam. Dengan 8.45 itu Prof sampaikan, kayaknya buka soalan tu sampai 9 lah kalau
Nak tahu dia saya cakap ni dia
sebab
masa.
sebab tahu best kalau macam sekejap aja.
Masa dia yang nak disampaikan spesifik sikit. So tak nak sikit sampai.
Itulah saya dah tengok tajuk pun excited macam tu kena ni sikit.
Dia jabatan mana?
Jadi aku dah
Oh,
dia macam kalau untuk jabatan ni buat so wakil jabatan lain yang jadi saya MO baru je kok. Saya habis besok datang semua wajib datang. Kesimpulan which is
actually dia yang target group yang penting pediatri, hematologis, oncologis, breast endocrine surgeon yang banyak.
kalau PITS kami tak ada, PITS surgery adalah maksudnya spesifik for onco memang kami tak ada.
Pasal ni semua personal habis suspect. Memang tu
Memang tu ada.
itu yang banyak itu yang banyak akan ada stakeholders itu
Bedanya tu maksudnya dalam IVF yang
saya ada IVF tapi yang saya nak sampai ni benda baru dekat Malaysia supaya orang nampak, banyak orang tak tahu ni saya tak nak cerita detail sangat pasal UAG ni, pasal bersenjata lain macam saya bagi talk dekat general banyak superficial konsep dia. Jadi saya dah bagi dekat brand endocrine congress, gynecology congress. CME ada juga macam jadi sikit lagi lah untuk
pediatric
hematologi pun kalau ada
hematologi kita tak ada spesifik yang rumah maksudnya main rumah tu tak ada tapi specialist yang staff untuk ini ada.
Oh itu aja kita convocation dia tu
Ladies and gentlemen, as we're about to begin, please be seated and please fill in the front row first and ensure your mobile phone are switching to silent mode. Thank you. Before we start our CME today, I would like to give you an announcement. To sign in for attendance, kindly scan QR code on the screen that will be displayed before and after CME session, or can use attendance at live chat in YouTube channel. For those who join CME via online, any question can be asked at the chat box in YouTube link. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning to our honorable guest yang berbahagia Dr. Tunku Anas Fathi bin Tunku Ahmad, Deputy Hospital Director 2, all head of departments, specialists, and the rest of the Sharp executive staff. First and foremost, I would like to thank everyone for allocating your time and listening to the CME today. I am Nurul Farhan binti Mama Anafi from Leadership Department, will be your MC for today. We begin our CME with Kitab Al-Fatiha. Amin ya Rabbal Alamin. Ladies and gentlemen, a very interesting topic to be discussed today. The topic for today is Beyond Barrier, Ovarian Tissue Preservation, that will be presented by Professor Madhya Dr. Abdul Qadir bin Abdul Karim. A brief description about our speaker today. Prof is currently an Associate Professor and Consultant ONG in Hospital Chancellor Tuanku Mukhlis University Kebangsaan Malaysia Medical Center. He is also the current President of the Malaysian Society for Fertility Preservation. Without further ado, I would like to invite Professor Madhya Dr. Abdul Qadir bin Abdul Karim to present today's CME with the topic Beyond Barrier Ovarian Tissue Preservation. Please welcome.
Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Madam Chairman, Dr. Anas, Timbalan Pengarah, Ketua-Ketua Jabatan, kaki tangan HRPZ 2. Izinkan saya menyampaikan perkongsian saya pada ini dalam dua bahasa. Saya dah cek dengan Dr. Ni Ahmad, dia kata boleh dua bahasa. Okay. Before I start, I would just like to say thank you to Dr. Nick for inviting me
in order to share this enlightening new topic that most of you might not be aware of. As the MC had said, I'm actually the current or the first president of the Malaysian Society for Fertility Preservation, and there are certain things that we're trying to achieve in terms of distributing or sharing the knowledge among Malaysian doctors so that we can provide the service to Malaysian patients that has not been available this while. So before I start off, I have like until 8:45. I've been going around to see the stakeholders. Yeah. So today I was hoping to see our colleagues. Yeah, the ones that are of most importance are the ones that are taking care of the patients who need these services the most. Yeah? Which are our hematologist colleagues, our pediatric colleagues, our breast endocrine surgeons. These are the specialties that mostly sees the patient that require these services, and without them to refer these cases or know the existence of these services, so I think our patients in Malaysia will be at a disadvantage. Yeah. For the rest of you, it's just good knowledge so that you know that these services is available in Malaysia, and you can share with your patients or your relatives, and you can distribute the knowledge to them. Yeah. So this is actually the first time I'm giving to a common audience. Yeah? I've given talks to Breast Endocrine Society, the Gynae Oncology Society, and specific societies just to push ahead with this agenda on the services that's available in Malaysia. So what I'm going to just technical issue. Oh, okay. All right. Okay. So basically, I'm just going to share with you a bit on ovarian tissue preservation. Okay, this is the topic is something new, or it's a new service that we are providing here in Malaysia, so that Malaysian patients can have the benefit instead of going overseas. But basically, I'm not going to subspecialize too much. I'm just going to share with you the concept of fertility preservation and the terms and what is available. So this is actually where I work. Hospital Chancellor Tuanku Mukhris, UKM, since 1998. And I'm actually currently the head of the Advanced Reproductive Center, which is in terms of government settings, we run about the biggest fertility center in Malaysia for the government sector. So we do about 450 cases of IVF, which accounts about 4 to 5% of cycles here in Malaysia. So we do get a lot of referrals, and we try and expand our services in terms of research and services. So it's a small center, but we are moving ahead with new programs, and we're moving to a new center. We have new programs like programs for embryologists, and also fellowship for those who are interested, and also for nurses. They come from all over the country in terms of private and also government agencies, government hospitals to be trained at our center. So back to our topic. Most of you will ask from the topic, what is it, where is it? All these questions will be playing in your mind because it's something new. So I hope at the end of by 8:45, at least I can get certain message across to the audience, especially those who handles the patients mainly. So for mukadimah sikit lah, ya. Kenapa kita sampai di sini? Ni is something that is This is something that has came out in the news lately. Our minister in lembaga Kementerian Pembangunan Wanita dan Masyarakat has stated that their ministry is opening a sub-fertility center in 2029. And why this is so? Because if you can see our statistics for Malaysia, you can see the small graph. I can't seem to put my tak keluar pula dia punya arrow. But if you can see the graph on kadar kelahiran or total fertility rate. Okay. So if you can see this graph, this is where Malaysia is. Okay. This is why partly why I want to share with you is what is the relevance to our country. Kalau nak ditengokkan, line ni ialah kadar kelahiran di Malaysia, iaitu kadar kelahiran yang kita panggil replacement level, which is 2.1. So Malaysia since 2013 we have fallen down kadar kelahiran, dan kalau trend ni continue, memang trend ni continue, latest figures 2023 it's at 1.69, maknanya Malaysia menuju ke arah negara yang bukanlah negara tua, negara yang berusia, So in terms of economy, it will affect our country greatly, because there'll be less people supporting those who are at the retirement age. So this is why it is of concern. Memanglah banyak sebabnya. Ada sometimes due to lifestyle, kenapa tak nak anak, because dah modern, keluarga kecil. This is partly so. But what I'm trying to share is for those who actually wants children that might not be able to have children. So this is where we come in. So we want to share. But Malaysia pun, when I was trying to do the presentation, trying to share during meetings semua, there is no actual research yang mengatakan berapa persen actually yang memang electively tak nak ada anak. But if you go to the statistics, dekat Kelantan ni still okay, still more above 2.1. Even ethnic, kalau in terms of ethnicity, Malay still at the East Coast still okay, but the West Coast dah still even for Malays at the replacement value, Chinese and Indian affected really badly lah. Kadar 1.1, 1.2. Kenapa 2.1 ni untuk setiap pasangan? Pasal yang 0.1 tu biasa diambil kira kadar kematian di awal kelahiran. So that's why we need the numbers. Okay. So this is what I'm just going to share with you, a bit about the history, bagaimana kita sampai ke tahap sekarang. Nak faham beberapa terma yang saya akan pakai semasa presentasi ini, dan cakap sedikit pasal benda baru, OTC, iaitu Ovarian Tissue Cryopreservation, dan what are the barriers, the problems, and what we are as a society trying to do here for Malaysia. So how did we came about to this level today? Since 1978, the advancement in reproductive medicine, trying to help our population. In 1978, we had the first world IVF baby, Louis Brown. Louis Brown ni pun actually dah umur 40 lebih, dan dia punya anak pun pakai IVF juga, tapi it's not genetically lah, kalau IVF. Dia punya offspring tak semestinya. In 1986, about 8 years later, baru teknologi itu sampai di Malaysia, dekat Dr. Haris Harun. And in terms of government services, in 2001, baru Kementerian Pengajian Tinggi dekat UKM ada services. But in terms of Ministry of Health, sekarang ni dah ada set up a network of fertility centers for Ministry of Health. Closest dengan Kelantan is Terengganu, Dr. Nasuha is there. She runs the services, but there are 4 centers dekat Malaysia for Ministry of Health. Yang saya highlightkan tu 2005, ialah the first birth from ovarian tissue cryopreserved during reproductive age. Ya, makna sejak 1990-an dia orang dah cuba preserve tissue ovary ni, ya. Tapi 2005 grup dekat Belgium yang telah preserve kilang telur atau ovary yang diambil oleh dari wanita yang telah akhir balih ni, dia berjaya letak balik selepas perempuan tu selesai rawatan dan berjaya dapat anak, ya. Lain advances pasal transplanted uterus, Malaysia tak ada lagi, ya. We are trying to pursue that, ya. Kita dah ada workshop on transplant uterus on animal workshop dekat UKM, but we are trying to push. Itu pun ada banyak halangannya dan isu-isu yang terbaik, tapi itu pun kita sedang cuba lakukan dari dekat Kementerian Pengajian Tinggi. Dan latest development ialah 2016, ya, gambar yang bawah tu, first birth from ovarian tissue during prepubertal age. Ya, yang dua saya highlight tu ialah berkenaan dengan topik today lah. Ya, yang maknanya sejak 2016 pun dah ada untuk pediatric group, sebelum dia akhir balih dia dah ambil dia punya tisu untuk disimpan sementara pesakit itu menjalani rawatan yang boleh menjejaskan tisu-tisu ovary. Jadi ini apa yang saya nak sampaikan yang perlu faham sikit, pasal kadang-kadang even those dalam obstetrics and gynecology, even the subspecialty itself has confusion, ya. Jadi generally memang ada confusion, ya. Apa maksud terma yang saya letak dekat sini, ya. So basically fertility preservation ialah terma umum lah, the umbrella term. Dia bermaksud any procedures ataupun any proses yang kita cuba selamatkan tisu gamet, sama ada sperma ataupun usai ataupun reproductive tissue, ya, testis ataupun ovary, supaya dia dapat digunakan di masa hadapan untuk pasangan tersebut mempunyai anak biological child of their own, ya. Sekarang ni ke teknologi barat dia ambil derma saja, ya, tapi dekat Malaysia ni still tak dibenarkan, dan takkan dibenarkanlah melalui guideline yang latest, ya. Yang oncofertility ni bermaksud dos yang kita fokus, ya. Fokus maknanya pesakit-pesakit yang mempunyai kanser yang akan menjalani rawatan yang kita tahu akan menjejaskan tisu sama ada sperm ataupun oocyte mereka, ya. That's why I was hoping ramai breast endocrine surgeons, hematologists, pediatricians, ya, even rheumatologists, ya, those who are involved in giving radiation or chemotherapy that can affect the gonads, ya. So these are our primary gatekeepers for all these patients. So this is what we are focusing at. And then ovarian tissue cryopreservation is just a technique of fertility preservation, ya. Banyak lagi teknik-teknik yang saya akan kongsikan, ya. Saya tak nak go into detail, tapi this is in broad terms what it means. So nak senang faham, saya dah buat slide ni, dia macam matematik lah, set dan subset, ya. Terma umum dia yang biru tu fertility preservation. Oncofertility ni is one of the indication, ya. Indication maknanya kita fokus dekat Malaysia ni sekarang ni, kita fokus pada pesakit-pesakit kanser sahaja, ya. Dan salah satu teknik untuk memelihara kesuburan ni ialah ovarian tissue cryopreservation, ya. Jadi some of you might ask who is suitable, ya. I've actually listed down yang color-color tu actually just yang in reference to the previous slides lah, ya. So indication saya listed down, ya. Kalau nak senang tengok, dia ada malignant, non-malignant, ya. Personal social reason, itu kita tak masuk isu-isu kontroversi, ya. Yang we are trying to focus on are those who really admit, ya, those who have malignant conditions that will undergo treatment, chemotherapy, radiotherapy, so on and so forth. And also for obstetrics and gynecology, specifically pelvic cancers, besides radiotherapy semua, we have fertility sparing surgeries. Ya, itu pun lagi detail, lagi panjang, 1 jam pun tak habis yang tu. Ya? Dan even kriteria ya pada topik kita pada hari ini yang ovarian tissue saja, memang bukan semua orang sesuai. Ya, nanti saya akan kongsikan sedikit pasal dia ada kriteria tertentu siapa pula sesuai pada untuk menggunakan metod ini. Tapi yang what I want to say, the take home message from this slide kan, there are a lot of indication. Here in Malaysia, we are focusing on cancer patients and ovarian tissue. Kalau nak tengok kan, is one of the method, but it's actually for those yang suitable, it only applies to about 5%. Yeah? Yang lain 95% tu, although it's not available, mungkin dia tak available here in the East Coast, ya, mungkin susah nak transfer patient semua. There are other methods, mungkin for the Ministry of Health, mungkin boleh refer to Terengganu kalau sesuai, but there are also issues with that, ya, in terms of funding semua. So these are other indications lah ya yang saya sebutkan tadi ya, hematology, autoimmune, gynae cancers, and also even in UKM we have unit pediatric adolescents which sees most of these patients ya, yang ada all these Turner syndromes. I'm not too sure dekat sini ramai patients like this ke tak ya, but these are the patients who are at risk of premature ovarian insufficiency that might be suitable for tissue preservation. Okay. Alright, so this is also another snapshot, ya, gambaran umum supaya semua orang faham yang pasal yang biru tadi ya, yang saya sebutkan tadi, fertility preservation, dan yang hijau bawah tu ovarian tissue saja. Ya, ini adalah modality for those in ONG. Ada juga fertility sparing surgeries yang saya tak masuk dalam slides ya, tapi itu pun banyak ya, nak sub jenis cancer dia. Tapi in terms of yang lain, modalities kesuburan yang dekat bawah tu, okay, maknanya even if they are going for radiotherapy, for male boleh testicular shielding, for female ovarian shielding transposition. Ya, kalau kos menjadi isu dekat Sabah Sarawak, tak ada, susah nak hantar kan isu, best if you can give GnRH analog ya. Untuk lelaki yang belum akhir balik, so far teknologi tak ada lagi untuk testicular tissue punya freezing. We are still trying to work on it. So far tak ada lagi concrete data yang boleh pakai in a large scale ya. Post pubertal dah senang, we can just freeze the semen ya. Saya akan cerita sikit isu-isu dengan tu, freeze the semen. Yang topik kita hari ni ialah ovarian tissue lah. So that has been going on. We have brought that to Malaysia since 2020, mid 2020, when we started the services of freezing ovaries ya. And then yang benda-benda yang dah lama ada dekat Malaysia since 1986, yang oocytes freezing dan also embryo freezing ya. So in terms of Ministry of Health pun dah ada dah ya, in terms of this center. So what do you do when you see this patient? Yang paling senang dekat sini rujuk Dr. Haslan lah. Dr. Haslan ada dekat sini ya. Tapi it's actually not straightforward lah. There's a lot of issues that you need to discuss with the patients ya. Yang saya dah tunjuk tadi, dia punya option. Tapi the main thing is the patient preference ya. Saya dapat rujukan banyak juga ya, dari private, government. Tapi what we can do is we tell the patients what are the options ya. Tengok dia punya profile, and not all patients ya. Rata-rata only about 60% yang akan opt ya. But at least we offer them, there is the facility if they are considering to have these options. Yeah. Tapi dekat Malaysia ni kan, and this our areas of focus, kena faham the pediatric age group yang those who are at concern, biasa the counselling is with parents, ya. Pasal patients kadang-kadang dia muda lagi, dia tak sedar all these problems. Pasal when I started off, the problem is after treatment semua, refer is a bit too late. Dah habis chemotherapy, dah habis radiotherapy, dah memang oocytes all destroyed, is a bit too late to do anything. Yeah? But now that if you see these patients first, at least you refer and tell them there are these options. Kalau dia tak nak lah, ya, tak boleh buat apa. Ya? At least there is options of this facility here in Malaysia. What is available and allowed here dekat mungkin dekat HRPZ, mungkin kena refer lah kalau tak ada IVF center or fertility center. Mungkin ada GnRH analog saja, even sperm freezing before chemo pun mungkin not available. But you can discuss what is available, what is allowed. Ya, kalau ada facility mungkin nak refer ke Klang Valley. Ya, kalau ovarian tissue mungkin nak remove the ovary here and transfer for freezing dekat Klang Valley. Those are options that need to be considered. And the last key thing is those who are seeing patients directly, those in the oncology clinic, in the breast endocrine clinic, when you first see the diagnosis, our hematologists, these are what we call shared care lah. Pasal once you get the diagnosis, this is the one you want to refer terus. Pasal I understand, my friends in breast endocrine, our urologists, our pediatric oncologists, sometimes they are a bit worried to counsel because they are also not sure. It's human nature, maknanya kita nak bagi tahu pun kita takut pasal kita pun tak tahu sebenarnya benda ni apa yang ada. So what I'm trying to say is just refer lah. It needs to be a phone call away. Dia tak boleh, it can't be the normal red tape, maknanya ambil this referral letter, pergi ambil appointment dekat SOPD ke dekat klinik, lepas tu dapat appointment 1 week later, 2 weeks later. Tak boleh, it doesn't work like that. It will be a bit too late. Some malignancies you have time, tapi you would have wasted 1 week, 2 weeks of the time that if the patient decides for treatment, fertility preservation, that can be used in terms of modality. So the best thing is once you have a diagnosis, just call Dr. Haslan ke someone and have a counselling so that at least the patient is informed. Dia tak nak lah, tak apa. At least they know their options. So because the reproductive specialist will discuss with the primary physician juga, either the rheumatologist ke siapa yang nak bagi chemo tu, how much time they have. Okay, because the key thing is we don't want to delay atau jeopardize dia punya primary disease, which is the malignancy. That's not the concept. Treat juga is just we want to see what options. So based on how much time that the oncologist or breast endocrine surgeon ataupun gynecologist nak start chemo, how much time dia ada, that will help decide what sort of modality that we can offer. But we don't want to delay the primary disease punya treatment. So patients pun kadang-kadang there's a lot of things on their mind. But these are the things that usually we share with them. Sometimes it's a bit overwhelming. Itu pasal kadang-kadang we just tell them, bagi pamphlets, and then after 1-2 days, the news of malignancy just sink in. This is sama juga. Masa saya pergi dekat Oxford tu pun dia kata sama, the same problem. Sometimes when you first break the news, you have this malignancy, nak cerita pasal fertility preservation is a bit difficult. So biasa the parents lah akan sit down tunggu juga, because now most of the malignancies are detected earlier, so their survival rate is better. So when survival rate is better, once they are stable, they intend to start a family. So we want to sampaikan benda tu lah ya. We don't want macam zaman dulu a bit too late, masa dah habis treatment semua dah nak refer, baru kahwin, then it's a bit too late. So these are what the patients biasa dia major things yang dia nak kena tahulah ya, or what you want to share with the patients, the impact of cancer or anti-cancer treatment towards their fertility. What are the options tadi ya, oocyte ke, embryo ke, tissue ke ya. Lepas tu isu-isu cryopreservation ini the reproductive specialist can explain later on if they decide for fertility preservation, and what are fertility treatments involved. Later if I have time, or nanti siapa nak tanya about the cost issue dekat Malaysia and how the Malaysian network is set up actually, and then also what do you expect pregnancy after anti-cancer treatments. Most of the subspecialty macam breast endocrine, hematology ada their own congresses where we talk about these things. So but basically what I want to say is it is not straightforward lah. Yeah, it's not straightforward, and it's need to have a collaboration or multidisciplinary between patient and clinician to discuss what options are available. And here in Malaysia memang tak boleh lari lah the monetary aspect, ya, nak pilih yang mana. So beyond the barriers, so this is our journey ya dekat Malaysia. So we have made a society, the fertility preservation, ya, to champion this cause and make sure it's available ataupun disseminate it lah ya. Dekat Malaysia, dekat even in Southeast Asia tak banyak center. Here in Malaysia we have a center, an onco-fertility center in Hospital Chancellor Tuanku Mukhris. So we've pursuing this agenda, and we've trying to train people, and it's going to be as a society it's going to be like this, because I've gone to most of the societies and hospitals to give talk like this. Religious scholar in terms of fatwa, Malaysia yang was a big issue was yang fatwa 2003 ya, yang saya ada highlight, yang highlight this was the issue. So we've actually spoke masa tu 2019 ya, Permaisuri Agong was very interested, and they got the mufti wilayah masa tu, mantan dia Datuk Sri Zulkifli, and ada dia punya mesyuarat musyawarah which allowed oocyte and sperm freezing before marriage for cancers. Tapi yang keputusan tu memang specific for cancers lah. So even yang kita nak bawa balik, you try transplant tu pun sekarang we are trying to do paperwork to overcome fatwa haram yang just recently came out 2014 ke 13. But that's another story. Lepas tu we are trying to provide expert. We also having workshops for the embryology semua on how to do this, and also for the clinicians to train supaya they have some knowledge on how to do it or how to counsel, and also setting up the services here in Malaysia. Memang susah sikit ya. In terms when we wanted to start off in 2020, memang ada a lot of barriers ya. Maknanya in terms of importing all the equipments, medias, is because it's a new service in Malaysia, although it's worldwide dah established, tapi these are the problems. And also we liaise with a center for UKM. We liaise with the Japanese group, which is the leading center in Asia for this ovarian tissue preservation. So basically for oncofertility, dia punya basic structure tu dah ada cuma it's not streamlined maknanya kalau as I said, yang ovarian tissue ni only about 5% sahaja yang needs it. The rest fertility preservations in terms of oocyte atau semen ataupun embryo freezing dah memang dah ada lama cuma it's not streamlined, and kadang-kadang when the diagnosis happens, kita nak straight away with treatment, we tend to forget about it. Cuma after a while, after patient dah good prognosis, dah survive, masa tu it is a bit too late. Okay, so knowledge preventing the referrals lah to the appropriate physician. So this is the main issue here in Malaysia. And then presence of appropriate physicians and counsellor. Still Malaysia, we are still lacking in that. And then in terms of providing a full spectrum of services, mungkin semua tempat tak ada, ya, tapi in UKM memang dah ada semua all the modalities, ya, including ovarian tissue preservation, ya. Tapi in terms of other services, Terengganu ada, HKL ada, ya, dekat Ipoh pun baru nak buka ada, ya. These are Ministry of Health punya centers that's available. Cuma you just in terms of Ministry of Health, the punya problem is it might not be in the agenda of Ministry of Health, ya, in terms of funding. Pasal diorang pun ada dia punya queue waiting list panjang lebar, ya. We usually get referral pasal the queue is too long, ya. So if you want to terms of onco fertility yang kena buat cepat before cancer treatment, maybe it's not suitable because maybe it's not in that direction of thought lah, ya, of the ministry. Tapi I'm glad yang Kementerian Pembangunan Keluarga tu nak start tu, will try and push this issue, yeah, for those who needed it. Yeah, so this is what we need, yeah, rapid access, a good interdisciplinary, yeah. So semua orang kenal Dr. Haslan kan, boleh refer saja, yeah. What are the lab requirements and counsellors. So the barriers, yeah, what we are trying to improve is education awareness, yeah, even in our CMEs, our curriculum, we are trying to insert this slowly to make everyone aware. Even like 2 years ago pun still some oncologists might not be aware of ovarian tissue, but now I'm glad that we've gone around the country and explained what are the options here available, yeah. The facilities, accessibility, so each state, the expert memang dah ada in terms of Ministry of Health. Here the closest mungkin HUSM. Kalau tak ada, available, we're going to talk about air transport, ataupun bawa pakai kereta, financial issues, in terms of what you can finance in Ministry of Health. Kadang-kadang kalau ovarian tissue, the oophorectomy still covered lah, even at our center. The cost that I will share, macam oophorectomy, if Ministry of Health, government, GL still free lah, but the extra procedures after that is not covered, student coverage still tak ada, and then Ministry of Health punya funding pun is another issue lah, so it's the same everywhere, even in Japan they have the several issues, funding semua ada masalah. Only until one of the members of parliament was affected with cancer and wanted fertility preservation baru ada funding. Kalau tak ada. If bos-bos besar kat atas tak affected, dia tak nampak sangat isu ni. Others guidelines, in terms of for Malaysia, kita dah ada our expert opinion for fertility preservation, all specifically for pediatrics, hematology, gynecologists. We've done our guidelines. If I presented even for the gynecologists, saya dah present dekat Congress gynecologists, tapi ada all the subspecialty ada dah dia orang punya fertility preservation. In terms of region issues, that one we still need to disseminate, and also the networking lah, the accessibility of all these facilities and procedures. So that it's easier, a clear pathway to refer. Macam here HRPZ, if you have a case, macam mana nak refer direct ke, you want to talk to the OAG department, Dr. Haslan dulu, how are you going to go about it? So I've actually shared, boleh scan ni. This is a simple what you call that, brochure, boleh faham, and I think normal physicians, medical ke surgical boleh faham. Biasa kita nak bagi pun takut pasal dekat bawah tu dia tulis please refer to your physician. Pasal kalau primary physicians baca pun tak fahamkan, dia memang takut nak refer. Nak bagi pun takut pasal dia takut patient tanya dia balik kan. Biasalah takut. Kita tak tahu, kita takut lah. Tapi I made this in simple terms so that senang nak faham, and at least they get a broad idea. Sementara the diagnosis is there, baru dapat diagnosis, dia nak baca sikit, get a general idea of what to ask. Kadang-kadang it's overwhelming, nak tanya apa pun tak tahu. So at least they get some general idea on what are the options. So in Malaysia, our ovarian tissue first case we did in August 2020, zaman COVID tu, and I think up till last week already 25 cases of fertility preservation, of ovarian tissue cryopreservation, mainly from ovarian cancer. We have our own onco-fertility clinic. So this is what we're trying to achieve. We want to promote fertility preservation awareness, promote networking, establish guidelines. We've done that. Platform for Malaysian database. Ini basically nak pressure ministry to provide some funding and opportunity for research and collaboration. Okay, so these are the onco-fertility centers in Asia yang dekat-dekat. Kalau tak nak refer dekat UKM Malaysia, dekat Jakarta ada satu, dekat Jepun ada. These are the centers. So we've launched it and we've started the services lah. So in terms of is Malaysia ready lah, beyond the barriers? So the demand is there. The demand sekarang ni banyak yang kita tahu is only on the private side. Itu yang senang nak refer because of monetary. Government definitely ada, cuma the pass flow and monetary, pasal dekat HTA, dekat HKL, HTA tempat Aziza memang banyak, dia punya oncologist semua ada refer, is just the funding lah. The demand is there. The expertise is already there in Malaysia. In terms of other modalities memang ada. Ministry of Health memang ramai dah. Facilities ada. It's just that needs money lah. In terms of financial, mungkin kita still tak ready lah, Malaysia. In terms of ministry, financial awareness, that's what we're trying to do. That's why I'm here today. In terms of knowledge, semua dah cukup. Okay, so this is what I'll share with you, the importance, the relevance. Kenapa? Who are we seeing actually? Patient macam mana? Ini latest Malaysian National Cancer Registry. Dia come out every 5 years, and next year sepatutnya keluar lah the next 5 years. Tapi this is the latest. So memang kita ada banyak cancer. So nampak yang the red arrow sini. Okay, the red arrow, this is the area, the group of patients we are focusing at, fertility preservation. Kita tak ada nak preserve fertility kalau patient 60 tahun ke 50 tahun. We are focusing at the younger age group, and this is the top 5 cancers lah. As you can see, yang purple is the breast cancers. So the breast endocrine surgeons will see patients that need most. ONG will see these two, tapi relatively memang the breast surgeons would see most. Pasal in Malaysia, that is where the caseload is. Okay. This is saya share. Okay, ini in terms of age group. Age group ni yang saya highlight, ni 0 to 14, 15 to 24. What sort of cancers, what sort of patients yang akan in need, who will be seeing them? Leukemia patients, neuro, lymphoma. So basically the hematologists, the very pediatric groups, and then a bit adolescents, still lymphoma, thyroid, ovary, leukemia. Unfortunately Malaysia punya data dia tak divide below 40, tapi once you reach 25 above, up to 59, the breast endocrine surgeons will see most of these patients that will require fertility preservation. Okay, Okay, another 2 minutes. So if you have any questions, you can always call me or WhatsApp me or email me kalau segan. I'm usually reply within the same day, within 12 hours. Any referrals you can refer. This one I want to share because selalu orang tanya cost. Ini cost dekat my center in HCTM, which is cheapest around kalau banding dengan private lah. Ya, nak banding dengan Ministry of Health centers tak boleh pasal Ministry of Health dia 4,500 plus some medication mungkin boleh dapat 7,000, 8,000. Even LPPKN is much higher. Tapi the problem with that is they have waiting list. Okay. So the top bit kan, even for ovarian tissue preservation, if you're talking about doing an oophorectomy, kalau dia ada guarantee letter, free, tak ada, kena bayar 2,000 lah. Yeah. But the ovarian tissue process kan, the freezing process for the first 5 years of freezing pun, it can go about 8,500. Yeah. So kalau campur-campur can go up to 10,500. Kalau dia nak freeze telur usai, ya, usai, pasal usai ni katakan macam breast cancer kan, breast cancer biasa they have about gap about 2-3 weeks before they start chemo, so we can stimulate them. Medication pun depending what you use 3,000 to 5,000. The process of picking up the eggs about tak nampak about a few thousands. Lepas tu nak freeze the usai, so it can go up between 9,000 to 11,000. Kalau dia dah kahwin, senang ada partner, ada semen, embryo, tapi the cost is still going to be about the same. This is dekat UKM lah. Ya. Sperm banking, kalau dah hamil balik senang ya, just before dia nak buat orchidectomy ataupun nak bagi radiation, you can just freeze. Ya, saya rasa dekat Sultanah Zahirah ada, Dr. Nasuha ada freeze. So tapi kat UKM about 250 for 2 years. Ya, the rest sperm banking maintenance, frozen maintenance, dia tak mahal sangat lah, over 2 years, 5 years. Ya, so later on kalau dia nak undergo, kalau natural mungkin kalau suitable boleh, tapi you're talking about rata-rata dekat Malaysia, kalau cheapest at our center is 11 to 12,000, ya, can go up to 13,000, tengok pakai ubat mahal ke tak, ya. Tapi kalau private center rata-rata about 18 to 22,000. Okay, so I think itu sajalah saya nak share. 8:45 dah, ya. Yang lain ni tak apa, kalau ada discussion later on, ada soalan, saya akan cuba menjawab lah. Kalau saya tak boleh jawab hari ni, saya akan WhatsApp jawapan. 8:45 dah tepat habis. Kalau ada apa, sesiapa nak tanya, ada soalan berkenaan isu-isu spesifik, saya akan cuba rungkaikan lah. Ya, pasal dia banyak sangat areas. Pasal it's a new area and it's a sub-specialized area. So saya tak go into detail all these other things lah. Ya, saya nak get the message across. In Malaysia, we have everything. It's just sometimes the expertise. You can always refer, dekat saja. It's sometimes monetary saja, the restriction here in Malaysia. Siapa nak finance, ya. Tapi kalau biasanya most of the cases biasa parents yang finance.
Assalamualaikum warahmatullahi wabarakatuh. Prof, terima kasih atas perkongsian yang menarik. So untuk saya ada 2 soalan lah. Quite worry juga ada Prof tunjuk graf tadi lah, yang kita punya birth rate dah makin menurun. Okay, macam Prof mention tadi, few factors yang menyebabkan the rate is reducing, either because of the lifestyle, the financial issue, and as well as because of subfertility itself. So in terms of this, yang mana yang paling main factor, well, is the main factor for that between these two, lifestyle, financial, or even the subfertility issue. Yang keduanya, Prof mention tadi SUKM, the biggest centers for this IVF procedure being done in Malaysia, right? So it's the successful rate for this IVF in SUKM lah. Because I think when we want to refer a patient to any center, they will ask which one is the best. Alright, I think, and the third question mainly for our ONG department. Apa actually kalau tuju in terms of kita punya subfertility in HRPZ and specifically for CKNK level, because sampai bila kita nak refer to HSNZ, even Klang Valley semua tu. Sekian, terima kasih.
Terima kasih banyak-banyak. Saya akan cuba jawablah walaupun saya tak tahu jawapan sebenar. Jadi at a national level, kadar kelahiran ni memang dah ada. Tapi if you're talking about data, memang tak ada. Itu memang persoalan ni masa saya pergi mesyuarat dekat kementerian, dekat Putrajaya pun memang this is the same question. Memang sebelum pergi meeting pun saya dah cari data dekat Malaysia, tak ada. We don't actually have, nobody has actually done research or epidemiological study to see which is the main factor kadar kelahiran turun. Is it elective atau subfertility per se? The general consensus is a combination of both. Maknanya kehendak masyarakat delaying. Bila dia delay, that will cause delay, maknanya delay starting a family. Delay starting a family, dia dua isu dekat satu lah. Satu, delay kadar kesuburan pun memang akan berkurangan. Yang kedua, size-nya pun, size keluarga yang dia nak pun akan berkurangan. So both these contribute. Tapi kadar berapa persen actually cause the rate to drop drastically, nobody knows. Maknanya your guess is as good as mine. Pasal tak ada no actual data. So susah nak cakap. So nanti bila saya pergi mesyuarat pembinaan ni, nanti saya akan highlight lagi isu ni, pasal saya pun ada isu-isu dengan pembinaan pusat kebangsaan ni. Pasal HUKM punya center, we are the biggest government center lah. We are not the previous biggest center. Pasal private center dia punya cycles lagi besar, dekat KL, JP, very big center. Success rate, ini nobody actually knows because nobody actually declares properly. Yang declare pun saya pun tak percaya. Kan? Pasal saya tahu tipu. Kan? Pasal if you've been practicing, you know, benda ni susah nak tahu, pasal it's patient dependent. Patient dependent and also it's sub-classified. Malaysia, oldest woman kan, oldest female that has a biological child 47. Yang derma-derma tu tak kira lah. Oldest is 47. So kebanyakan patient yang datang sekarang, depends on the center, akan they have what we call that a very bad prognosis to begin with. Datang umur 40. 40 ni once you come, rata-rata pun chance drop 10% sahaja. So in terms of success rate, depends on the patient profile. Tapi if you're talking about average, memang about 30%. Tapi you cannot compare a 30-year-old to the 40-year-old. So itu kadang-kadang patient tak faham. Patient nak tahu success rate je. Lepas tu center ni kata 80%. 80% dia bagi HCG, dia buat UPT positif lah. Saya boleh buat macam tu. Kan? So it's you need to take that with a pinch of salt. And then ada teknologi-teknologi lain yang also they are venturing into, macam buat pre-implantation genetic testings. This sometimes helps a bit, tapi again cost factor lah. Tapi rata-rata once you have a center having more than 250 cycles a year, biasa dia dah stable. Usually memang akan be about 30-35%. Depends on the patient profile.
Kalau saya pun, kalau patient saya memang akan nak cakap sekarang muda memang chances, tapi kalau buat IVF, bila we extract the embryo, tengok usai bentuk pun dah horrible, that could be the cause that is not seen before. Tapi yelah, kalau pesakit dia tak boleh ceritanya tu, tak nak tahu success rate saja. So it is very difficult to say. Ya. Untuk soalan ketiga pasal hala tuju tu. Macam mana pasal hala tuju?
Untuk kita hospital, untuk infertility is under KKM punya plan. Right? Untuk East Coast dengan akan cover. Dan untuk lab tak easy, lab tu up to beratus ribu, mungkin million. Satu dia punya machine tu pun boleh rosak kat Terengganu. Waiting 70,000 untuk preservation tu. Saya tak bagi lagi, so banyak prosedur attendant. Right? So it's totally under KKM lah. Right? But then we just have infertility problem, boleh refer kepada kita, saya dengan Dr. Wan in charge. Right? Kita akan identify lah those yang suitable untuk IVF. Kita akan consult dekat sini. In fact, Dr. Nasuha berproduktif actually datang monthly visit dekat kita punya klinik. So dia akan jumpa, dia akan masuk dalam list lah untuk those yang untuk IVF. Dan waiting list sekarang 1 tahun. Okey, 1 tahun untuk IVF, untuk buat IVF. Bukan untuk jumpa boleh jumpa terus lah. Okey, untuk buat IVF 1 tahun. So in between that, kita adalah prosedur IVF ke apa ke dulu. Right?
Saya nak kongsi sikit lah Ministry of Health punya. Dia punya bajet tak banyak ya. Bila saya cakap dengan ketua servis Ministry of Health pun, one center dia ada Ipoh, Terengganu, rata-rata is going to be about 100 to 150,000. So they have to distribute ni and play around with the budget to help as many patient as possible. So you only have that budget. In terms of setting up a lab pun, macam UKM, we are going to move to a new center. Equipment saja is about 2 million. Nak renovation about another 5 million. Ni exaggerate lah sedikit ya. Tapi you can do with 5 million pun cukup dah kalau ada.
Actually bulan 10 kami dah ada meeting dekat national level. Saya try nak push Tanah Merah, kita nak buat laparoscopic center and the infertility center. But the problem when the national subcommittee kata kita dah ada USM. So dia kata guna sama USM, kalau saya dengar USM saya pun senyap lah. Dia kata memang tak boleh sebab bajet lah. Prof cakap bajet. Kita dah try push. So dia minta kita liaise dengan USM, dia orang try nak push money through USM. Tahu nak cakap ni?
Nanti saya akan sampaikan ke USM.
Saya tahu mungkin Dr. Ni boleh cakap dengan national, because isu ni isu yang kita panggil duplicate service. Zaman-zaman dulu memang kita worry about duplicate service. Contoh kita ambil adalah neurosurgery, kardiotorasik. Tapi the moment kita kata tak boleh duplicate service because USM dah ada, this is yang kita tengok balik in term of financial. Kita keep sending patient kita pergi ke sana, actually the cost is not cheap. Even is much higher compared kalau kita manage juga kita punya center. Neurosurgery pun dah start bising at national level, and then they plan to send one of the neurosurgeon to di Kelantan. And then now state level dah develop, dah start meeting untuk plan tubuhkan neurosurgery dekat HSIB. I don't know until when. Even kita pun di tapak Wisma pun kita dah plan lah. One of the trauma center kita terikudi surgical department adalah neurosurgery. So looking forward, kita tadi kata tak boleh nak buat because duplicate service kat USM. Kita kena fight juga on the side, insyaAllah in the future.
Prof, the problem with USM, 2 weeks ago, we have a presentation on hepatitis.
Also, they have a center in USM. The problem with USM, we are not too, they are not too friendly to us. That is the issue, yeah. But in terms of when we look at the government, there's no point of duplicating the service because we are both government sector and it all costs money. So there's no point of duplicating. But because of personality problem, it don't seem to be too friendly. That's the issue, actually.
Okay.
If you can convey the message.
Okay, I do understand. Tapi it is at a higher level ministerial. Kalau konsortium hospital awam, we have a consortium. Saya tak direct involved lah, Tapi because I'm the head of one of the largest center, memang the direction when I speak to pengarah and our pro vice chancellor, memang even for ini konsortium hospital universiti awam, they are focusing more on not duplicating at Ministry KPT lah. Maknanya mana hospital universiti macam UKM nak fokus on bariatric surgery ataupun fertility. So hospital UITM they'll focus on something else. So they want to streamline the funding macam tu. Ni pasal ni minister lah, dia orang punya consortium. But interministry, because I'm not too sure, because saya tak pernah attend any of those meetings in terms of Ministry of Health and KPT, because HUSM would be another ministry. So saya pun tak sure how the MOH punya officer boleh cakap not to duplicate Ministry of Higher Education, because in terms of Ministry of Higher Education dia lain. Itulah. But I can convey to my friends in HUSM. Tapi saya kenal semua yang ONG je lah. Ada soalan-soalan lain pasal ni? Chemotherapy ke? How fast you need to do ke? Biasanya kebanyakan cases yang perlukan chemo lah. Even after chemo pun we can still do, tapi dia punya options limited. Ini Kementerian Pembangunan Wanita Masyarakat ni dia nak buat dekat Shah Alam. Itu dia punya news lah dekat section 7 2019 2029 sepatutnya running. Bajet besar. Pasal dia melalui kementerian lain, dia punya menteri bagus, dapat funding banyak.
Thank you Prof for the great presentation. So kalau ada lagi soalan mungkin boleh direct melalui Prof email. WhatsApp. Okay, so if there is no more question, I would like to invite Yang Berbahagia, Dr. Tengku Anas, to deliver the certificate of appreciation to our respected 2D CME presenter. Please welcome. Thank you, Prof. and Dr. Finance. So with that, we end our CME today with Surah Al-Azim. That's beautiful.